Contamination OCD. Individuals with contamination OCD are excessively worried about germs, toxins, or getting dirty. They fear contaminating themselves and others, which makes them see everyday environments as unusually risky. Their main compulsion is to clean excessively. This includes washing hands repeatedly, using disinfectants on surfaces more than necessary, and avoiding direct contact with things like door handles by using tissues or gloves. People with this OCD type often avoid physical contact, like handshakes, and may shy away from public places like restaurants. They can appear anxious and overly cautious, trying to manage their exposure to potential contaminants. Symmetry and order OCD. Individuals with symmetry and order OCD are consumed by a need for things to be perfectly aligned or arranged in a specific order. They are driven by an intense discomfort when objects or their environment are not orderly or symmetrical. Their compulsions involve arranging and rearranging items until they feel just right. This may include aligning books, utensils, furniture, or even organizing daily activities into rigid schedules. They often repeat these actions multiple times to achieve perceived perfection. In social environments, these individuals may be seen adjusting objects around them, such as straightening table settings or organizing items on a desk. They might seem distracted or disengaged during social interactions because they are preoccupied with maintaining order around them. Harm OCD. Individuals with harm OCD constantly worry about causing harm to themselves or others, even if by accident. They are haunted by thoughts of unintentional injury or disaster. To manage these fears, they often engage in compulsive checking behaviors. This includes frequently checking that appliances are turned off, doors are locked, and even retracing driving routes to ensure no accidents occurred. In social environments, people with harm OCD might appear very cautious or anxious. They often seek reassurance from others about their safety or the safety of their actions, asking multiple times if everything is okay. Hoarding OCD. Individuals with hoarding OCD have a persistent fear of throwing items away. They worry that they might need these items in the future, or that discarding them would be a mistake, often feeling a strong emotional attachment to the items. The main compulsion is accumulating and storing items, regardless of their actual value or utility. This behavior includes collecting various objects, rarely discarding anything, and often creating cluttered, unmanageable living spaces. People with hoarding OCD may avoid inviting others to their homes due to embarrassment about the clutter. They might also seem distracted or anxious when topics about cleaning or discarding items arise in conversation. Religious or scrupulosity OCD. Individuals with this type of OCD are preoccupied with fears of moral or religious failure. They may obsess over whether their thoughts or actions are sinful or offensive to a higher power, constantly worrying about moral purity. The main compulsion involves engaging in excessive religious practices or rituals, such as repeated prayer, confession, or avoidance behaviors to prevent perceived moral transgressions. They may also compulsively seek reassurance from religious leaders or texts to ensure their actions align with religious laws or moral standards. In social situations, people with this type of OCD may appear overly concerned with ethical or religious topics. They might ask others for moral judgments or avoid social events that could lead them into situations they perceive as morally questionable. Sexual orientation OCD. Individuals with sexual orientation OCD experience persistent doubts about their sexual orientation. They obsess over whether they might be gay, straight, bisexual, or another orientation, regardless of their actual sexual experiences or identity. The compulsions in this OCD typically involve repeatedly checking their emotional or physical responses to thoughts or images of different sexual orientations. They might also compulsively seek reassurance about their orientation from others or through consuming related media content. In social settings, people with this OCD may appear anxious or distracted, especially in conversations or situations involving romantic or sexual topics. They might avoid such discussions or settings that trigger their obsessions or compulsively engage in conversations seeking clarity about their feelings. Relationship OCD. Individuals with relationship OCD obsess over doubts about the suitability or love in their romantic relationships. They frequently question if they truly love their partner or if their partner loves them enough, creating constant uncertainty about the relationship's validity. The compulsions associated with ROCD often include seeking reassurance about the relationship from the partner or others, compulsively comparing their relationship to others, and repeatedly analyzing past interactions for evidence of genuine affection. People with this type of OCD may seem preoccupied or distracted when out with their partner, or during social gatherings. They might frequently bring up relationship issues for discussion or appear visibly anxious about their interactions with their partner. Existential OCD. Individuals with existential OCD are consumed by deep philosophical questions about the meaning of life, death, or the nature of existence. They obsess over existential concepts, questioning everything from their own purpose to the reason behind human existence. The compulsions related to existential OCD often involve excessive reading, thinking, and discussing philosophical or religious texts and theories. They may repeatedly seek answers from philosophical or religious leaders, or engage in endless mental analysis to try and solve these unsolvable questions. In social situations, people with existential OCD might dominate conversations with deep, philosophical discussions, which can be off-putting or confusing to others. They may also seem distant or distracted, as they are preoccupied with existential thoughts. This type of OCD can isolate individuals from others, as their preoccupation with existential concerns may not resonate with peers or loved ones, leading to feelings of loneliness or misunderstanding. Relationships may suffer due to the individual's intense focus on existential issues, which can overshadow more practical or immediate concerns in life and partnerships. Health anxiety OCD. Individuals with health anxiety OCD obsess over concerns about having or developing a serious illness. They are hypervigilant about bodily sensations and symptoms, interpreting them as signs of severe health conditions. The compulsions in health anxiety OCD typically involve excessive health monitoring, such as repeatedly checking for symptoms, excessive medical testing, and constantly seeking reassurance from doctors or online resources. In social situations, these individuals may frequently discuss their health concerns or avoid environments they perceive as risky for their health, such as places with perceived poor air quality or where they fear contagion. They might also frequently step away to check symptoms or manage their anxiety. This OCD subtype significantly impacts the individual's ability to enjoy life and maintain normal daily activities, often leading to distress and decreased quality of life. Perfectionism OCD. Individuals with perfectionism OCD are obsessed with achieving an unrealistic standard of perfection in various aspects of their life, including tasks, appearance, and organization. They fear making mistakes or failing to meet these high standards, which can cause intense anxiety and distress. The compulsions associated with perfectionism OCD include excessive checking, redoing tasks repeatedly until they feel perfect, and spending an inordinate amount of time on simple tasks to ensure they meet their standards. They may also engage in excessive list-making and organization. In social settings, people with perfectionism OCD might seem overly critical or demanding, both of themselves and others. They may struggle to enjoy activities because they are focused on details or errors, rather than the overall experience. They might also avoid participating in activities where they cannot control the outcome to their satisfaction.